You're absolutely right. Both ends of the contract in buying food need to deal with these risks. If young people have got friends who will support them to ask the question and to perhaps make a bit more fuss than they're inclined to do, then that's one end of it. From the food business point of view, a lot of simple controls that they're already doing are good allergy controls, and they need to have the confidence to wash their hands properly, to clean down properly, to maintain the dishwasher properly. These are all really important allergy controls. Well, these young adults with milk allergy concern me enormously. We've had some deaths from milk deliberately included in ingredients, but unexpected. I mean, who knew that there was milk in doner kebab meat sometimes? People ask for things that are plain, and this worries me because they think in their head that plain means it's just chicken or whatever, and of course it might have been marinated, and this is a great concern. The other thing which is difficult for people to deal with is that they think that because their friend's got a nut allergy and the business can look after the friend with a nut allergy because nuts might not be so widely used. If they've got a milk allergy, it's exactly the same, and of course in a catering business it's not necessarily the same. So I think it's a tough call, and businesses need to understand that there are more people who are asking about milk because they have a serious allergy rather than a preference or a lactose intolerance or a milk intolerance. And classifying your customers is also quite important. That can help. If dairy means lots of different things to different people, including perhaps eggs, some people think eggs are dairy, it's really quite misleading and a concern. I mean, another issue is how many people have confidently told me that their macaroons don't contain nuts when they're full of ground almonds. I mean, people don't realise that ground almonds are nuts. We just need clearer communication all round, really, and overcoming these linguistic challenges amongst everything else. If there is a culture where you just go, any allergies? In certain cultures, I think that could be really positive, and it's just that prompt that will push somebody over the line into taking a little bit more of a proactive approach for themselves.
Absolutely. I think it's a fundamental. If we're going to have shy individuals who aren't going to tell you, I'm finding it more and more often when I dine out that I am being asked, not only when I'm giving my order, but also being presented with my food. They're double checking, and I strongly encourage that. I think local authorities should learn the lessons from their colleagues and share information. That, the Megan Lee case shows them the way it can be done. There are loads of other examples in the press. They should be encouraged to share. This is not about operating a cartel, it's about learning from each other, using Section 14, which is nature, substance, quality demanded by the purchaser, and framing their cases so that they capture the offence effectively. And then when they present a case in the courtroom, actually considering the sentencing guidelines and all 9 steps, and not just stopping after they've considered culpability and harm. They need to also consider likelihood of harm and the extent of the people that will be affected by an allergenic reaction. Most of them get hung up about charging decisions from our research. There were 30 different summonses issued in the 50 cases that we looked at. Just phenomenal there could be such a diversity of approach. It's almost as if you should do a simple, straightforward flowchart of, have I got this, that and the other, right, that should be my approach to prosecution. And maybe they need some guidance from the FSA or guidance from internally, having discussion panels or something. The Health and Safety at Work Act is designed for health and safety rather than for food cases. And if you're going to use the Health and Safety at Work Act, you have to be prepared for a defence team to be very aggressive and say, you have law that you should be using, why are you not bringing the charge under that provision. And on many occasions they're used in the Health and Safety at Work Act because they're out of time with their original charging. It's not designed for these scenarios. I can understand it being used, but I'm not a fan of using Section 3.1 in these cases.